Good morning for everyone, and I'm glad to see you again, and thank you for coming today. And I would like to continue my topic about the bone health. And today, as far as we have the 2 days of some practical lectures, so I would like to show you my experience, my patients' cases, and I think it would help for your future practice. So I also need to mention again that all this material only for education purposes. You know already me. And objectives lecture will be about the main algorithm of bone health assessment, and this is I will explain in my clinical cases with my patient. So I already talked that the osteoporosis is silent epidemic, and main aim to diagnose osteoporosis, to treatment osteoporosis, is to prevent the first fracture because it leads to a cascade of fracture. And we always, when we talk with our clients, need to know more about the history, about the lifestyle, because when we go through this all possible risk factors for bone deterioration, we can open not only osteoporosis or bone disorders, we can open another diseases which can be revealed due to bone deterioration. It happened in my life, in my practical life. That is why I would like to share with you. So come again, so to assess the risk factors, you can provide for your clients even simple 1-minute test when they are sitting in order to visit you. When they fill in all this, the questionnaire test, and if we can check even one positive answer, means these clients have some probability and possibility of osteoporosis. Also, we need to assess the risk factors because, as I mentioned yesterday, for example, DEXA also have not in all clinics. And for example, REMS technology, which we have in European Wellness, only 3 devices on whole Malaysia, and 1 device in European Wellness on our Borneo Island. So the main aim of treatment osteoporosis is to initiate in proper time treatment. That is why we can use this FRAX risk. You had yesterday my lecture and lecture special for FRAX risk assessment tool. So it's easy to download some on-site International Osteoporosis Foundation or other tools, fill in online and receive the results. And based on the guidelines of your country, because, for example, as Professor Grigorio mentioned yesterday, for Ukrainian, even we have lower percentage which we can start treatment, initiate the treatment of osteoporosis, because in Ukraine, the worse condition with bone mineral density. So also we need to assess some risk of falling. So if patient has the muscles weakness due to sarcopenia or dizziness, so of course they will have the not osteoporotic fracture, not only osteoporotic, and I will show in my clinical experience case. Also available the new FRAX tool, which includes some somatic condition which can deteriorate bone quality without bone mineral density decreasing. So bone mineral density we can receive after DEXA, after REMS device normal, but patient can have the osteoporosis fracture, and so we need to exclude some secondary reason like primary hyperparathyroidism, and I will talk about this disease also in my case. So for Asia, available the 3 options, depends what you want, and go through this algorithm. So first of all, we need to understand what kind of group risk our clients, and depends on this group risk, we have direct recommendation. Very easy. I think it's also understandable. So about some results of densitometry, because I will show today the protocols of my clients. So for postmenopausal, for men over than 65 years, we need to use the T-score. If we can see these results in first field, it's a normal, then osteopenia and osteoporosis. And based on this, we have some ways to management this patient. Also, we need to know some evidence base which medicine still don't have some evidence which the medicine can decrease the risk of future fracture. I always should ask my patient about the lifestyle, because it's very important what lifestyle, because without this, all these risk factors, we cannot improve bone condition only by recommendation our some calcium supplementation, vitamin D, or some anti-osteoporotic treatment. If, for example, low physical activity or high caffeine consumption, more than 4 cups daily. It's also very important, as well as maintaining the condition of our gut. Also point to some physical activity which improve bone mineral density. This is a weight-bearing exercise, no swimming. That is why also I need to mention about this. Sufficient consumption of calcium, at least 1000 milligrams daily. And we will talk about some cases with kidney stone disease. And tomorrow I will give you a lecture with some recommendation how we need to maintain the patient with kidney stone disease. In part also this pathology. Vitamin D also need to maintain according to the norm, and very important, then if we have some reason for kidney failure with a GFR less than 60, we understand that vitamin D metabolism is violated, and we need to recommend alpha-calcidol as an active metabolite vitamin D. Also K2 supplementation important, because it prevents the vascular calcification as well as the prevention of kidney stone disease. And we have our own product, MF3 in Univit, with 5,000 units of vitamin D and 100 K2. Also, stem cell therapy, for now, it looks like perspective treatment. And we have some study. This study continue, and when we receive the results of effectiveness, so I will show you, of course. And our list of precursor stem cells, we have also precursor osteoblasts, which we recommend in our clinical trial. And our peptides and exosomes, which also can be helpful. So let's go through the clinical case. So this is clinical case, the female, 63 years old, menopause 12 years, and complains only low back pain. After the DEXA densitometry, we receive 2 different results. So on spine, we have the osteopenia. On hip region, we have osteoporosis. How we need to make conclusion, whether it's osteopenia or osteoporosis. Yesterday, I show you the comparison with a DEXA on the spine region and REMS technology. So DEXA can calculate this is osteophytes or some calcification of vertebrae, like positive plus positive tissue. That is why the DEXA in lumbar spine region not always occurs and precisely compare with the REMS. But we have another zone. So if either we have here on lumbar spine or hip region level of T-score minus 2.5 and below, so it means the osteoporosis. When we check the major osteoporotic risk factor, or FRAX, all fracture is 13, so not more than 20, but hip fracture 4.7, so it's more than 3%. So both results as a densitometry, as a hip fracture, allows us to initiate anti-osteoporotic treatment. What does it mean? It means it's a calcium, vitamin D, it's a only basis. It's not treatment for osteoporosis. It's only like basic medicines, but we need to choose some anti-osteoporotic treatment. Also very important, there's some markers of bone metabolism, because they can say more than only like recommendation to treatment of bone disorders. Parathyroid hormone is normal, vitamin D normal, calcium correction on albumin normal, osteocalcin. Osteocalcin is the marker of bone builders or osteoblasts. And beta cross labs is the marker of activity of osteoblast. So this is marker in range of normal, not unusual. When we calculate our clients' data, so T-score, we check neck, minus 2.5, and frax, one of data frax, hip frax, more than 3%. So our patient in high risk. What the recommendation? First line, it is bisphosphonates or denosumab. I think it's very easy to understand how we need to manage these clients. Next clients, a little bit difficult because it's a male, 32 years old, with a hypertension, medical history of kidney stone disease, recurrent course oxalate after laparoscopic lithotripsy, but again, this client was referred by urology to me, and diagnosis looks like the kidney stone disease and secondary renal parenchymal arterial hypertension. What we can reveal abnormal? GFR a little less than 90, dyslipidemia, and low vitamin D. And also go to the densitometry test. So this is a 32 male person. So we should not check by T-score, but lowest data, this T-score, but it's not applicable to this age. So we need to check Z-score, and Z-score normal below -2. So even if we see these results, that's like osteopenia, you should not look to the machine diagnosis. You need to think clinically. So for young, we need to check Z-score. This is normal, but this client has the oxalate and recurrent kidney stone disease, and by the applanation tonometry, this client has not appropriate level of blood pressure. That is why there's some evidence of increasing the vessel stiffness. So regarding the European Association of Urology, in case of oxalate, we have to recommend the calcium supplementation to absorb intestinal oxalate. And that is why for these clients, some treatment was changes for losartan, indapamide, filadip, calcium citrate plus vitamin DK2, not due to the bone mineral density, due to the hyperoxalaturia. This is chronic process. And after 3 months, we can check that normalize the blood pressure as well as the oxalaturia. And then I contact with these clients, no more some oxalaturia, no more exacerbation of kidney stone disease. Next clinical case is also not, it's unusual because it's a female but 23 years old, and she has a menopause 3 years due to surgical. So despite on the age, after surgical reason of menopause, we should think that this is like postmenopausal women. And then this is also kidney stone disease, low vitamin D, high level parathyroid hormone, creatinine level high, and low GFR. So this is condition with a normal than calcium, condition of secondary hyperparathyroidism, what I told yesterday and first day. What about the our densitometry test reveals the osteopenia. So in our guidelines, osteopenia should be treated by calcium, vitamin D, right? This client also has the oxalate and according to the recommendation of urologists, we have to advise supplementation with calcium. But due to presence the kidney stones, first step should be percutaneous contact lithotripsy, because other treatment is the alpha calcidol, is the calcium, vitamin K, D3, K2, is the relative contraindication. This first step should be lithotripsy. Next clients, female, 30 years old, complains periodic pain in the lumbar spine of the mechanical nature, referred to me by a traumatologist due to low energy fracture of femoral neck. So the FRAX 7 is normal, hip also below than 3, and densitometry. Densitometry, as the 30 years old, we should check the Z-score, Z-score normal, and normal, because above -2. These clients, in these clients, we revealed the low level vitamin D. That is why I need to emphasize that in my previous lecture, I show you 3 phases of bone turnover. First, it's resorption, then restoration, and next stage is mineralization. So even our clients have the normal bone mineral density. In insufficiency of vitamin D, it can also change the quality of bone, and the bone fracture occurs not due to low bone mineral density, due to low quality of bone. Focus your attention on this. Next clinical case is about the female, 73 years old, menopause. So we done the diagnostics. We receive the expectable results like osteoporosis with a vertebral fracture. You can see that we have on these slides this vertebral fracture. And what we can see on the blood test, we can see that the calcium correction higher than norm, beta-2 microglobulin higher than norm, parathyroid hormones and phosphorus are normal. So we need to remember that for osteoporosis, never character high level calcium. If we can see in our clients high level calcium, we need to exclude other reason for lysis of bone. In this patient, we need to recommend the bone marrow biopsy after the proteinogram, protein electrophoresis with immunofixation, which reveals the M protein, Ben Jones protein, and refer to the oncologist. And finally, on this patient was confirmed the myeloma disease. So does it matter that we have osteoporosis? If we have some reasons for high-level calcium, it's not only simple osteoporosis. It's accompanied with other disease. We need to, of course, exclude the onco cancer. Other clinical case, it's a man, 46 years old, low back pain, and also kidney stone disease. Was referred to me by a urologist. And when we do the test of densitometry, as far as it's young, so we need to check not but this is like T-score. that score is normal. But we can see that's a gradually decreasing the bone mineral density. And on the blood test, we revealed the high level of calcium and very high level of parathyroid hormone. So and oxalate. What is your diagnosis? Can you guess? So high level calcium correction and parathyroid hormones. Primary hyperparathyroidism. So this is disease of parathyroid glands, adenoma of parathyroid glands. And after adenectomy, without any treatment, the urine test, 24 hours salt excretion normalized, calcium parathyroid hormone normals, and after some time we repeat densitometry test, and it was not like negative, so osteopenia. No, it was normal, but we have improvement this bone mineral density, and also disappears back pain. So how important to assess all parameters of bone health to achieve the correct diagnosis and correct way for treatment our clients. That is why in conclusion, I need to emphasize how important to pass through all this test, all this management algorithm to achieve the good results. Thank you for your attention. We have some question. I think we will answer on Q&A session, right? Yeah, thank you.